St. Mary's Joint Hospital is located in Amaigbo, Wangele Local Government Area, Imo State. It is owned by three parties: the Amaigbo Community, the Imo State Government, and the Roman Catholic Mission, represented by the Catholic Diocese of Orlu. The matron is the head of St. Mary's Joint Hospital, Amaigbo. The hospital has a bed capacity of 210 and has 85 members of staff, including 2 medical officers, 4 staff nurses, 1 pharmacist, 1 lab scientist, and many junior staff members. Prior to the introduction of modern medicine, healthcare in Amaigbo was provided by traditional medicine men, using roots and herbs with methods passed down in families from one generation to the other. Orthodox medicine was introduced to Amaigbo by the Catholic Church, as people would gather after church services, and treatments were provided for various ailments. For the church, this had an obvious advantage. It won over converts to Christianity, as well as the confidence of the community. The people of Amaigbo decided to build a hospital in 1941 and approached the Catholic Church for support. Reports have it that the community levied themselves 3 shillings per person to raise £1,300, with which they initially approached the church. After protracted negotiations about where the hospital could be located, the Amaigbo people identified and donated to the project a sum of 44 acres of prime land on the banks of the Wangele River in Ubahu, Amaigbo. Land was donated by the Amaigbo community, and a commitment to manage the hospital by the Catholic Church was made. At this point, the Amaigbo community and the Catholic Church jointly approached the colonial government of Eastern Nigeria for funding. After a series of meetings, an agreement was reached on the 14th of February 1948 to establish a hospital, and it was agreed that the government would be responsible for financing the building, while the Catholic Church would execute the project. An original plan for an 83-bed facility was agreed and costed at £30,000. This was funded by the Colonial Development Corporation, or CDC. The building was completed in 1954, and the Amaigbo Joint Hospital was declared open to the public on September 10, 1955, by the Minister of Health at the time, Dr. Michael I Okpara. The hospital played a critical role during the war, caring for the sick and injured, despite relentless bombings. Many war survivors have a story to tell about a visit to St. Mary's Joint Hospital, Amaigbo. Sadly, despite the incredible services it provided during the war, the end of the war brought great despair, as many fleeing soldiers and refugees looted the hospital of its sparse belongings as they returned home. The hospital has not received any significant upgrades since it was built in the 1950s, and almost destroyed at the end of the Civil War. The hospital lacks even the basic environment for care provision and medical education for nurses. The facilities are in a very dilapidated state, with the mortuary being the most functional part of the hospital and the source of most of its revenue. The buildings are very old, the roofs are leaking in multiple points, and the ceiling is broken in many of the hospital wards. Water, sanitation, and hygiene is challenging in the hospital, as there is no running water and electricity supply is sparse. The vision of this project is to support the rehabilitation of St. Mary's Joint Hospital, Amaigbo, and to provide sustainable healthcare services for all that seek care in the hospital. Further objectives include repositioning St. Mary's Joint Hospital, Amaigbo, to provide good healthcare services to all its patients and provide excellent facilities for the training of nurses. Improving the infrastructure and equipment needs of the hospital to enable it to improve the efficiency in delivery of healthcare services. Supporting the staff of the hospital with training opportunities and incentives to retain staff and improve their motivation to provide healthcare services for patients. Improving the work environment of St. Mary's Joint Hospital to be nurturing and safe for staff, students, patients, and patients' relatives. And finally, supporting the development of a service building where patients' relatives can support the needs of patients admitted in the hospital, such as laundry and feeding needs.